Hi everyone, my name is John Lister and I'm a pre-health major with the intentions on attending physical therapy school. For my presentation, I'm discussing the growing epidemic of opioid abuse and what are the best strategies to stop it. Opioid pills are pain-reducing drugs. Opioids are medications that relieve pain by reducing the intensity of pain signals reaching the brain. Opioid pills stimulate a sense of euphoria. Because opioids are not rapidly broken down after acting, they continue to activate receptors for extended periods of time and produce a level of euphoria. Opioid pills are continuously getting easier and easier for people to obtain. Robert Jameson, professor of psychiatry at Harvard Medical School, says prescription painkillers today are all on the rise. It's partially an issue of availability. Vastly more people have access to these medications. Opioid pills are becoming more abused than cocaine and heroin. Opioid pill abusers build a tolerance, leading to physical dependency and mental dependency. After a period of regular opioid abuse, a person needs to evaluate the dosage to produce the same physiological effect known as tolerance, which leads to physical and physiological dependency. Opioid pill addiction can lead to an overdose and long-term defects. An overdose occurs when larger quantities than physically tolerated are taken. So, in order to reduce and eventually stop opioid abuse, there must first be a lengthy process to be cleared in order to get a prescription. If a patient potentially needs painkillers, they must go through a psychiatric evaluation. The new patient must go to a psychiatrist who is separate from the prescribing doctor to be evaluated for signs of addictive personality. Dr. Andrew Saxon, a professor of psychiatry and director of an addiction psychiatry program, says that it is clear for some people to have a genetic predisposition to addiction and that there is something different in their brains to begin with. Therefore, patients that have any mental illness in their family will be examined more carefully to make sure they're truly mentally stable. The people with these mental illnesses are at a very high risk of opioid abuse. The patient will not have access, and so they can double up on their pills, potentially. If the person is cleared for their prescription, they will have to be brought in for a semi-annual evaluation to see if they display signs of an addiction, and will lose their rights to the prescription if there are positive signs. Current people who are prescribed to any painkiller will be brought in and evaluated to determine if they're suitable to continue their medication. To maintain the use of opioids so the patient cannot abuse them and no one else can either, the pills will be only supplied in an automatic locked pill dispenser. These do already exist, but not in this manner. The American Pharmacists Association will mandate that all pharmacies are to distribute the prescribed amount of pills into the prescribed day or hour manually. The lock will only be open at the set day or hour to prevent abuse, and the person will not be granted key access to the lock. Since our technology is so advanced, the person can only access the pill once it's locked through a finger scan to identify that it's actually them opening. The pill lock will be refillable and can only be refilled when they are completely empty, as well as most health insurances will cover the initial cost of the pill lock and their continuing prescription. A benefit of the lock is that they are really not concealable. The current opioids today are supplied in small vials that can be easily kept in a pocket. With the bigger automatic lock, it will be completely obvious to what you're carrying. The current laws against the illegal opioid possession will not change. They should have been enough to stop the people from using them, but they weren't. So that's why we're going for this other approach. So, to recap, opioids are gaining a lot of interest over the country, and more people are using and abusing them. Their easy availability makes it simple for people to get their hands on them, and their stimulation euphoria makes people want them again and again. It is very easy to build up a tolerance and become physically and mentally dependent of them, which can cause an overdose that can cause long-term defects or death. So, to stop this growing epidemic, we must cut it off at the source. and make them a huge hassle for people to obtain, which includes the extended process to obtain and maintain the prescription, and to avoid abuse that can only be distributed in a pill lock dispenser.